Living through the COVID-19 pandemic can be extremely confusing and difficult for anyone. However, for LGBTQ+ folks and/or people living with HIV, it may be especially confusing when your questions about your risks and precautions may feel unanswered. That's why, in this video, we are going to go over some frequently asked questions to help you stay safe and healthy during this pandemic. You may be asking yourself, am I more at risk for COVID-19 because I'm HIV positive and/or a part of the LGBTQ+ community? Well, according to the CDC, people living with HIV who are on effective HIV medication have the same risk as people who are not HIV positive. However, people who have a weakened immune system are more at risk for COVID-19, meaning the risk is higher in HIV positive people who are either not on effective HIV medication and/or have a low CD4 cell count. Due to the general LGBTQ+ community's higher rates of tobacco use and lack of access to care, LGBTQ+ people have a higher vulnerability to COVID-19. Another question you may have asked is, what can I do to protect myself from COVID-19? Most importantly, you should try to avoid exposure to COVID-19 through preventative measures such as using hand sanitizer, socially distancing by staying 6 feet apart, and/or wearing a mask in public spaces. If you're HIV positive, it is highly important that you continue your treatment and follow the advice of your healthcare provider to keep your immune system healthy and happy. For many LGBTQ+ people, the pandemic has been hard mentally as well as physically, so it's important that you put your mental health first by trying to live a low-stress life during this time. This means eating and drinking well, getting 8+ hours of sleep, and continuing to exercise. It is also important to try to reach out within the community and find support. You may ask, what do I do if the pandemic has taken a toll on my mental health? Are there specific LGBTQ+ friendly resources available? There are many virtual resources available for the LGBTQ+ community regarding mental health. Support groups focusing on LGBTQ+ identities exist virtually, and LGBTQ+ friendly therapists are often offering teletherapy nowadays. For a therapist and/or a support group referral, call the Bradbury-Sullivan LGBT Community Center Infoline. It is important to note that you can get tested for HIV safely during the pandemic. Mail-in testing is available, where testing equipment is sent to your house for you to then send your samples back in the mail. At-home testing is also possible with the use of a rapid test. In-person testing is offered for free at Comprehensive Health Services at Lehigh Valley Health Network. For more information on HIV testing, please visit the Bradbury-Sullivan LGBT Community Center website.